Hi, my name is John Platero and I'm the CEO of the National Council for Certified Personal Trainers, and I'm here to talk to you about IT band syndrome. Iliotibial band, or IT band syndrome, is an overuse injury of the connective tissues that are located on the lateral or outer part of the thigh and knee. It causes pain and tenderness in those areas, especially just above the knee joint. The iliotibial band is a thick band of fascia that begins at the iliac crest in the pelvis and runs down the lateral or outside part of the thigh and crosses the knee to attach into the top part of the tibia or shin bone. It forms from the tensor fascia lata and two of the gluteal muscles, the gluteus medius and the gluteus minimus, and then stretches across the knee. The IT band is an important structure of the lateral part of the knee that acts like a stabilizer as the joint flexes and extends. Inflammation and irritation of the IT band can occur as it travels back and forth, crossing the bony prominence of the femoral epicondyle as the knee flexes and extends. Iliotibial band inflammation often occurs in long-distance runners, cyclists, and other athletes who repeatedly squat. IT band syndrome may be the result of a combination of issues, including poor training habits, poor flexibility, and other mechanical imbalances in the body, especially involving the lower back, pelvis, hips, and knees. Certain people may have a predisposition to develop IT band syndrome. Anatomical issues may include a leg length discrepancy, an abnormal tilt to the pelvis, or bowed legs, which is also called genu varum. These situations can cause the iliotibial band to become excessively tight, leading to increased friction and irritation when that band crosses back and forth across the femoral epicondyle during activity. For example, runners may develop IT band syndrome symptoms. If a runner always runs on the same side of the road, it can produce the same effect as having a leg length discrepancy. One leg is always downhill compared to the other, and the pelvis has to tilt to accommodate for the activity. Running too many hills in general can also cause inflammation of the IT band. Downhill running may increase stride length and stride rate. However, it is especially stressful on the IT band as it works to stabilize the knee. Cyclists may develop IT band inflammation should they have improper posture on their bike and toe in when they pedal. The issue may be how the cleats are aligned, forcing the foot to be internally rotated or toed in. Other activities with increased knee flexion, such as rowing and weightlifting, especially with a lot of squatting, can also cause symptoms. Pain on the lateral side of the knee is the most common symptom of IT band syndrome and is due to inflammation of the area where the band crosses back and forth at the femoral epicondyle. Initially, there may be a sensation of stinging or needle-like pricks that are often ignored. This can gradually progress to pain every time the heel strikes the ground, and finally can become disabling when walking or when climbing up or down steps. Some people may feel a snapping or popping sound at the knee, and there may be some swelling either where the band crosses the femoral epicondyle or below the knee where it attaches to the tibia. Occasionally, the pain may radiate along the course of the IT band all the way up to the outer side of the thigh to the hip. So take a guess. First thing, back off, rest. Heat it up before you stretch, and stretch before you exercise. I like to use an infrared pad. Heat should be applied before and during stretching for at least 5 to 10 minutes. Foam rolling and/or a massage at the site of irritation can help as well. Friction rubbing may help to break down inflammation and scarring. Ultrasound may also be used to help decrease irritation in the soft tissues surrounding the knee. Take a look at muscle strength and balance, and/or flexibility and gait analysis, which is basically watching a person walk, run, or cycle. Shoe orthotics may be useful if there's a gait problem, pelvic tilt, or leg length discrepancy as a potential cause of IT band syndrome. Ice after you exercise. Ice treatments using a cold pack applied to the area for 10 to 15 minutes is good, or try an ice massage, which involves rubbing ice over the inflamed area for 3 to 5 minutes or until the area is numb. Anti-inflammatory medications like ibuprofen, Advil, Motrin, and/or Aleve may be helpful. If it's really bad, cortisone may be injected at the site of inflammation. There's only so much you can do, but the first step is to back off. Pain is your body telling you something, so rest. So let's check out some of the foam roller movements, stretches, and massage gadgets you can use to get help rid of this IT band syndrome. Okay, when you foam roll your IT band, I'm gonna start from the top of the iliac crest. That's the top of your pelvis. I'm gonna roll down through the lateral side of my thigh, across the greater trochanter. Be careful, there's a bursa there, but I'm gonna roll across it. And I'm gonna go roll across all the way to the bottom of the knee. Right? And if I feel any tender spot, which could probably be down by the knee, I'm gonna stay over that, or maybe pulse back and forth. And you might roll forward and backwards to see what you can feel, and then roll upwards the lateral side of the knee till you get back to the iliac crest. Obviously, you're gonna do both sides. Okay, you can also foam roll your glutes. So for that, you gotta get onto your glute. You can't just be sitting on your sits bones. You gotta sit on the glute. Bend your knee and roll the glute. Now remember, the gluteus medius and the gluteus minimus are pretty high up. It's not your gluteus maximus. They're pretty high up. So you gotta try and find that spot. Okay, that's how you foam roll. And you basically spend 30 to 45 seconds to a minute doing that on each side. Okay, a stretch that I like to stretch the glutes and the lower back is this kind of piriformis, pigeon, whatever you want to call it, stretch. So I use a massage table. You could use a couch, a chair, whatever you want. Stick my leg up, right? And I've externally rotated it major. And then keeping my back in good alignment, I'm gonna step back and lean forward. I'm not gonna flex my spine, I'm just gonna lean forward. Oh, yeah. So you can stretch through the middle, then you can stretch towards the knee this way. Oh boy, that hurts. And then you can stretch the opposite way, this way. I'm really tight. So that's a good stretch. Of course, you want to do both sides. Same thing, lean forward. Lean towards the knee. Leans away from the knee. And I'm doing these fairly quickly because I'm just showing it to you, and it's pretty boring to watch me stretch. But that's a good stretch that I like for the lower back and the glutes. Besides foam rolling, you could use like a stick to roll your IT band. A couple things that I use is I bought this. This was fairly inexpensive. It's like called a thumper or something like that, and you can use that as well. And it's real easy to transport. And then I was given this by a good friend of mine, Deborah, and this thing, you turn it on, and these are like real hard pieces of wood. And when I would race and I would cycle and I would travel, I would take this with me. So then you just put your thigh along across like here and let this dig in there. It works. So a couple little massage things would be cool. There's all kinds of, you can use a lacrosse ball, you could freeze a tennis ball. I think you get the idea. So there you go. Okay, I hope that helps and gives you some insight to the basics of IT band syndrome. Stay fit. We'll see you soon.